So I don't want you to swallow any of the blood coming down the back of your throat. So I want you to put some water in there, gargle it all around.
Dr. Maya Cubitt's trying to get grandmother Miro's nose to stop bleeding.
When did it start bleeding?
I bled last night for an hour.
Yeah.
I was in emergency.
Here? Have you been in our hospital with that problem?
Yeah, I was here.
Yeah.
It's the second time in the last 24 hours she's been rushed to the Royal Melbourne Hospital for the bleeding.
Is it still going down the back of your throat?
Yeah, but I felt in my throat I have blood.
Do you think it's probably stopped now?
No, it's not.
Not now. Okay, I'm going to have a look.
It's still bleeding.
The anaesthetic spray Dr. Maya used hasn't stopped the bleeding.
In Miro's case, her blood is thinned. She's using a medication to stop her blood from clotting. It will clot, it just takes longer. We're going to move towards that horrible pack, but we're going to do it in stages. I'm going to try the spray again. The benefit of the spray, if we get it really covered in there, is that it'll help with the uncomfortable pack because it's a bit numbing. But in order for it to work well, we'll need to get the clots out first. The first thing we do is to try to clear out any of the things that might be in the way of the blood clotting. So we actually weirdly get her to blow her nose to try and make the surface of the area where we want the clot to form a nice clean surface.
But blowing out the clots will first make the bleed worse, and Dr. Maya prepares Miro.
So this is going to be really uncomfortable, hun, and I apologise in advance.
Miro's distressed, and her husband Ninad is yet to arrive.
Good one. Which side is it that's bleeding the most? The left? Both. Big blow for me. Blood is not something that people are used to seeing. It makes you immediately aware that something is wrong. So some of her fear is about her lack of control and her inability to manage the situation and her fear about what that means.
Dr. Maya updates her notes on Miro's condition while waiting to see if the bleeding stops.
Trust me! I'm
But the yelling from an aggressive patient nearby makes it hard to concentrate.
I think we convince ourselves that we can block it out, but it creates a general low level of stress, I think is the reality. And fear. Sometimes things get a bit out of hand.
JK, you let me know if you need a hand.
Dr. Sarah Whitelaw feels it too. Her husband is a surgical specialist at another hospital, but not in emergency.
There's obviously some of us that are less bothered by it than others. My husband will walk a kilometre out of his way to not walk through the emergency department. He just refuses to come and visit me there because he just finds it a horribly chaotic, loud, noisy, out of control environment.
Go away!
We just need to open the door. He's up to some sort of shenanigans.
Please open the door.
Over in the behavioural assessment unit, Dr. Martin Dutch is also dealing with a difficult situation.
I don't think it'll work.
Please open the door.
It's all last.
An agitated patient has locked himself in a toilet cubicle,
Please open the door. The security is here. Come on.
and security are standing by.
Otherwise, I'll go up to Sherilyn's office to get the toolbox. I'll go and do that. It's okay, you're not in trouble. We just can't have you locking yourself in the toilet.
Very nice.
As the Director of Emergency, Dr. Mark Putland worries about the abuse and violence his staff face.
It's a confronting environment and sometimes a risky one. It's a bit like being a frog in a pot of water that's getting hotter, and you can just kind of get used to it and take it for granted that it's part of your job. But when you sit back and look at it, actually, you think that's absurd. It's not okay. I think it's really important to keep calling that out, actually.
How about we turn off the light and see if you can get have a bit of a nap, yeah?
With the wayward toilet cubicle patient now restrained, Dr. Martin rejoins colleagues at the main desk when more trouble erupts.
Back off, mate. No, back off, mate.
Back off!
Go away. Go away. Back off, mate. No, back off, mate.
Back off!
Go away. Go away.
An aggressive man is trying to smear his blood on staff.
co-grade. So when you get some more sedation for me?
Security and staff hold the violent man down while he's sedated.
In that particular event, some of the other staff restrained the chap, which was great. It was a good example of how everyone has each other's backs in the place, which is really good, but it just shouldn't really be happening.
Are you okay?
Yeah, thank you. Thank you for jumping in.
I'm going to go and get the pack. I'll be back in a second, okay?
In a nearby treatment room, 62-year-old grandmother Miro is still suffering from a severe nosebleed.
It's not very nice to have blood pouring out of your face. She'll be scared.
It's being caused by Miro's blood-thinning medication for her heart condition. So Dr. Maya is getting an inflatable nose pack called a rapid rhino.
They're really uncomfortable. They go inside your nose and blow them up with air, and we push out to stop the bleeding. I've had a lot of experience of nosebleeds in my house. One of my children gets a lot of blood noses. And what I know from experience is that it's a really distressing thing. This is really uncomfortable. Yeah. Really uncomfortable. Sorry, lovely. But do you know what? I think it is helping, all right? It's really horrible. You have a good cry, that'll help, I think. It's really scary. And it's really horrible, but you're safe here, okay? I've got you.
Thanks.
Sometimes if we can provide that sort of calming atmosphere for people, they feel safe. It's a really scary thing to feel like you have to hand over control of your sometimes life and death situation, or your fear that it might be that, to somebody that you've never met. And with Miro, she's here because she's bleeding. She's clearly feeling scared about that. And my job is to build the trust that she has in my ability to deal with that. Okay. All right. I know it's horrible, but that bleeding has stopped. All right? Gave you a fright, didn't it? Yeah, it's okay. So I have asked the nose doctors to come and have a look to see if there's anything that we can do that isn't that horrible pack. All right? If it keeps bleeding, you let me know. Okay? You're a brave lady, all right? And you're doing a really good job. And this too will end. We just need to work through it a little bit at a time together, okay? You're a brave lady. Where's your husband? Is he coming? Yeah, do you want me to give him a call? Hi, is that Ninette? Hi, my name's Maya. I'm one of the doctors at the Royal Melbourne. Are you Miro's husband? He's on his way, okay?
Dr. Maya was able to stop grandmother Miro's nosebleed, which had bled out of control due to her blood-thinning medication.
It's really scary, but you're safe here, okay? I've got you.
Miro was operated on the next day by specialists who successfully cauterised the vessels in her nose.
Thank you. Thank you for
It's
your
lovely
help.
to meet you.